Okay, so we are going to be chatting tonight about natural tips to help with diabetes and to maintain a healthy blood sugar. And in a minute, I'm going to turn it over to Erica. That's who you all want to hear from. But I'm going to start off first with a couple of Young Living tips for diabetes. What I love about these calls and what you're going to hear from Erica is a lot of hope. Oftentimes we get a diagnosis and we feel like that's just the end. There's nothing we can do about it. You take a pill, you just are identified as that diagnosis the rest of your life. And in our community, we realize most of the time that's not the case. We do have power and we can be more than conquerors with a lot of things that get thrown our way health wise. And our current culture wants us to feel like we are constantly in fear for our health. And we don't approach it that way in this community. We approach it with empowerment, with prayer, with hope, and with realizing if we look for answers, we're going to find answers. And that's a lot of Erica's story and her recovery, personal recovery from cancer. And I want it to be your story as well. So we're talking about diabetes, but don't let that be like, oh, I got diabetes. It's the end of the story. It's not the end of the story. And there are things that you can do. Erica's going to tell you the most of them, but I'm going to tell you a few couple Young Living things that can help support a healthy blood sugar. I couldn't find it right away, but there's an oil called Ocotea, Ocotea. It's a little oil. It smells kind of sweet. And let me tell you about it. It comes from South America. And one of its uses is it may lower, I'm taking this from the desk reference, it may lower insulin needs for diabetics and reduce blood sugar fluctuations. It has a complex aroma, which may increase feelings of fullness, that constant hunger that you is associated with a symptom of diabetes. Well, the Ocotea can give you some of that sense of fullness, so you're not constantly eating and then you're on that cycle with your blood sugar. It's related to the cinnamon species, which cinnamon's super powerful for blood sugar and overall health. A lot of people will put several drops, a lot of drops probably if you're really wanting to target healthy blood sugars, in a capsule and take it daily. Obviously, talk with your health professional about it. When my niece, who has type 1 diabetes, was taking that religiously, along with the Ningxia Red, which I'll tell you her story about that in a minute, she definitely saw a more evenness in her blood sugar levels when she was taking it. But that's the key. You got to take it in order for it to work. So Ocotea can help stabilize blood sugar levels in a capsule. The other oil is Endoflex, and we've talked about this before with the thyroid because it addresses the entire endocrine system, which it's all related. And Endoflex can also amplify your metabolism. So if that's a contributor to your blood sugar levels, Endoflex might be something that you look into. I like to rub Endoflex like on my thyroid or over my adrenal glands on my lower back to help just balance out my entire endocrine system. Okay, I'm going to tell you 4 supplements, and I'm not going to teach you about them. I'm just going to tell you about them, and they might be helpful if you're wanting to target healthy blood sugars. One is multi-greens, and this is from Young Living. It is all of your greens, includes barley grass and kelp and so many good things in a pill form. There's multi-greens, Mega-Cal. So calcium is all part of this whole cascade effect with your blood sugar. So we've got that. Balance Complete is like a powder for a meal replacement, and it has all of the nutrients that you need in a perfect balance. So if you are looking to target that, and a meal replacement is part of your plan, Balance Complete might be something that you look for. And then Essential Zymes. Young Living has some really powerful enzymes in capsule form that can help with digestion and breaking everything down. The final thing, I did save the best for last with balancing your blood sugar, is the Ningxia Red. And I talk about this for everything. It's brain health, immune health, skin health, stress, sleep, antioxidants, and blood sugar. So it is super, super, super high in antioxidants. And it's also, because of all the fruits in here, it's antiviral. And I know that's going to be something that Erica is going to touch on for sure. It's pure nutrition for your cells. And the wolfberry, oh, I wanted to tell you this. The wolfberry comes from China. And I was reading about where we get our wolfberry. That's the berry that's in Ningxia Red. It comes from China. And it says wolfberry balances the pancreas and is a detoxifier and a cleanser. Listen to this. Diabetes is not common in certain areas of China where the wolfberry is consumed regularly. The low rates of diabetes in areas where they are consuming a lot of the wolfberry. Interesting connection, right? I know that Jeannie on here has dealt with diabetes, and when she was drinking Ningxia Red and had a foot wound, which you know that's really scary and dangerous for diabetics, her doctor told her that she was healing incredibly well. Asked her what she was doing. She said, Ningxia Red. He said, you're not healing like a normal diabetic. Keep doing whatever you're doing. So she had amazing results with this. My niece that I mentioned to you is a type 1 diabetic. Again, when she first started drinking this, again, you got to be consistent. Her A1C came down from 13 to 11. And then she was doing this in the Ocotea. And then I believe it came down from like 11 to 9 while she was drinking this. And so it's powerful. It works, and it gives your body what it needs to heal itself. And so that is my plug for Young Living products that can help balance your blood sugar. I'm going to turn it over to Erica Swinney, who has become a dear friend of mine, a partner in crime, a colleague on the front lines of bringing wellness and wholeness to our community. She's a holistic nurse practitioner in Sellersburg, and she is helping so many people. I am honored to get to work with her and cannot wait to hear her take on diabetes and healthy blood sugar levels tonight. So thank you, Erica, for spending your time. I know you're exhausted and slammed, so thank you for your time.
Yes, thank you. Thank you, Shannon. That was very kind. So diabetes. So what we need to first talk about is, what is it and where's the pancreas at and what does it look like? What does it do? So the pancreas is a kind of looks like a banana, and it's about 6 inches long. So it's a pretty big structure in the body, and it's located behind the stomach. It's attached to the small intestines, where it releases digestive enzymes to help break down our foods. And it also monitors our blood for sugar and to see when it needs to produce its hormone insulin in order to bring down blood sugar. So what is type 2 diabetes? So we think that diabetes, even type 1 diabetes, is all about sugar. It's not really about sugar. It's about a poorly functioning pancreas. So if you take a step back and you think about, okay, my pancreas is not working properly, why is that happening? Mostly for type 2 diabetics especially, it's due to a high-fat diet. It's due to being overstressed and eating way too much fat, which is clogging up our pancreases. And the pancreas can't function when it's clogged with fat. So usually the way type 2 diabetes starts is someone who is exhausted and stressed, poor nutrition, sedentary. Their liver in Chinese medicine, they believe that the pancreas is this delicate little flower in the center of our stomach, and that the liver protects it. So when you see somebody with diabetes, you have to assume that their liver is also very sluggish too and can no longer protect the pancreas. So the liver protects the pancreas. Also, the adrenals are involved in this too. The adrenals can produce, for people who fast a lot, people who go just normal days without eating for long periods of time just because they don't have time, the adrenals will actually produce a blend. It's not a sugar, but they will produce a blend of adrenaline the body will use as fuel. However, that blend of adrenaline is very toxic to our pancreases and can cause destruction of our pancreases. So people that eat a high-fat diet, are sedentary, are under a lot of stress, it's the perfect storm to develop a pancreas that is no longer functioning properly. So the pancreas will release insulin in response to the amount of blood sugar that's in the bloodstream. But another important function of the pancreas is digestion. They secrete a a large amount of digestive enzymes for us to digest our fats and our meats and our proteins and starches. And so that's often overlooked in diabetics. We worry so much about their sugar, but we also need to be concerned that their digestion is very poor too. Because they're not breaking down their foods properly because their pancreas is not able to do that. So in diabetics, we have to look improving their digestion along with improving their pancreatic function. So I don't look at diabetes as a blood sugar problem because it's not. It's actually a pancreas problem. And unfortunately, what diabetics end up being told is that they need to drop the sugar in their diet. And usually those people end up eating a lot of fat because of that. So their pancreas gets worse and more dysfunctional over time. Now they're on their fifth medication and now they're going to insulin. So the diabetics I've been caring for, I have recommended to them that they need to go on a low-fat diet and they need to eat a ton of fruit. And those that are following that and doing that are seeing remarkable changes in their blood sugars. They are coming off all their medications, including their insulin. So diabetes is not about sugar because fruit has a lot of sugar in it, but sugar in fruit is a very long acting sugar. It will not create diabetes. It will actually keep the pancreas clean so it stays functioning normally. So we kind of have to flip our thinking about diabetes. Diabetes is actually caused from stress and from eating a ton of fat. That's what diabetes is truly caused from. And so you put these diabetics on a low-fat diet and tell them to eat a ton of fruit, and the pancreas will repair and regenerate itself and shed the fat, and will start functioning normally. And that's what I've been seeing in my practice. Unfortunately, even your type 1s respond very well to this too. Type 1 diabetes is actually due to viruses. It's a viral attack on their pancreas. And so unless you treat a type 1 that as if they have a viral infection, they'll never recover from it. So even with the type 1 diabetics, I tell them the same thing, low fat, high fruit diet. And those that do that, their pancreas doesn't recover completely, but they get much better sugar control. And that's like what the Ninja Red is doing, is detoxifying and nourishing their pancreas at the same time. So with diabetics, it's really easy to reverse them. It's very easy to do that. And I have just seen it. And it happens within a week or so. People are dropping their insulin levels and dropping their blood sugar medications. So now their sugars are getting too low because now they're over medicated. So diabetes is very easy to reverse. It is very easy to reverse if we don't follow the American Diabetic Association's recommendations. So all the people, even pre-diabetes, now a lot of people are pre-diabetic, which means that their sugars are staying a little bit too high in their bloodstream over a 3-month period of time when they get their A1C measured. So pre-diabetes is a precursor to full diabetes, but pre-diabetes that's gone on longer than 5 years, they are considered diabetics. They are considered to have the same risk factors as a diabetic that has an A1C in the diabetic range. So I have some people who have been pre-diabetic for close to 10 years, and they don't think much about it because it hasn't moved into diabetes yet. But anything over 5 years in the pre-diabetic range, you need the eye exams, you need the feed exams, you need to really change your diet, and it's considered just as harmful as if you were a diabetic. So diabetics, I encourage you to eat your fruit, okay? Don't be scared of your fruit. Don't worry about the carbs. Don't eat 4 or 5, grapes. Eat a big bag of grapes. Eat watermelon. Eat papaya. Some of the things that are really nourishing to our pancreas are blueberries, papayas, blackberries, apples, and raspberries. Those are the top 5 fruits that the pancreas loves, and it will help nourish and shed the fat and the toxins and viruses out of your pancreas, and it will start functioning normally after that. And I truly believe type 1s have that possibility too. Any organ that's damaged in the body can heal and repair itself. The body only wants to do that. And so I have some type 1s that are really taking this on, and they're really doing a great job. However, if they get stressed again, if they're poor diet again, the pancreas just gets clogged up back easily again. But those are another thing I want diabetics to start eating is potatoes. They still steer clear from potatoes because of the starch in them. It's a complete misconception. Potatoes are very powerful antivirals, and they really help shed the fat and the toxins out of our pancreases and our liver. Another thing diabetics have to be cautious of, they have to keep the stress down in their lives and they have to eat. You know, so many of us will, and myself included, will go 8 or 9 hours before I have anything to eat because I'm so busy. But I try to make myself to stop and eat some fruit every few hours, because if I don't, then I know my adrenals are kicking in, and then the fatigue will kick in, and that will predispose me to diabetes. Now, low blood sugar, a lot of people have that hangry where they can't go over 2 to 3 hours without eating before they start feeling really restless. That is another precursor to diabetes that's often overlooked, as when people have low sugars or they get all that hungry feeling when they've gone several hours without eating. That's another precursor to diabetes. So you have to make sure that you're eating something about every 2 hours, and preferably fruit and vegetables, and that will keep your adrenals healthy, and that will clean out your liver and clean up your pancreas all at the same time. And this will happen very, very quickly. The diabetics I've been caring for, within a week or so, they're already dropping their medications. So it's really quite powerful for them to start eating this way. It's completely opposite of what they've been told. But we are here not to treat their blood sugars, we're here to heal their pancreases. And that's where the focus needs to be. And to detox, and, you know, spirulina, some of the products we're talking about are great. I can see why they would work, because they're detoxers and they're nourishers and they're antiviral all at the same time. So any of those type of products that you can take are going to be very beneficial to not only your pancreas, but your liver too, which you want the liver healthy again so it can go back to protecting the pancreas again. So the pancreas, the liver, and the adrenals are all very, very connected to each other, and they all depend on each other to keep the body healthy. And when one organ system is overstrained, it does affect the other organs. So that's kind of the highlights on diabetes. It's very, very simple. Eat your squash, eat your sweet potatoes, eat your raspberries, your berries, eat all of the fruits you can eat, and lower the fat in your diet. And your sugar, you will reverse prediabetes, you will reverse type 2 diabetes, you will get better control of your type 1 diabetes, and you will not have those low blood sugar events like so many people experience now.
Okay, that's wild. And it is difficult to wrap our brain around that, because it's the exact opposite
Right,
of what we've been told.
exactly. Yeah, and the diabetics, they get worse over time. I've just seen it. They just get worse, and they don't know why. They're like, well, I'm not eating any sugar. I don't eat any. I may have, you know, one scoop of ice cream once a week, and that's all in the place I'm getting. But why are my sugars still so high? Well, it's because they have too much fat in their diet, and so now they develop insulin resistance. So any insulin they are producing, the cells have shut down. They're not even taking it anymore because they're so inflamed. So think of our cells having little doors on them. And when the cells get really inflamed and swollen, those doors swell shut. And now the insulin that has the key to the door can't get in the door. So it's knocking and knocking and knocking, but the cell is so swollen and inflamed, it can't even get its key in there to allow the sugar to get in. So the insulin is the key to to allow the sugar to go into the cell. And insulin resistance is when the cells are so inflamed because of all the fat in their diet, it's not allowing the insulin into the cells, and that's insulin resistance, which is also a precursor to diabetes. But most diabetics that I counsel, they are insulin resistant. They have been eating so much fat for so many years that they're not even responding to insulin anymore. You give them insulin and nothing happens. It doesn't lower their sugar, nothing. They keep going up on their insulin. They change their insulin. None of it works. Well, what they really need to do is just drop the fat in their diet and eat more fruit. And that way the inflammation will go down, and those doors will now be open again, or they'll allow the insulin to get back into the cell again, or let the sugar back in.
So I would assume that you tell diabetics to eat the fruits and the vegetables, and you can have healthy sugars, but that's not an excuse to go eat a lot of Twinkies or donuts just because you've said sugar is okay.
Right. Exactly. So the processed sugars are a big no-no because they are short-acting sugars. So they keep the pancreas on its toes. The pancreas is constantly spiking out insulin to keep up with a processed sugar, whereas fruit sugars are very slow-acting sugars. So they maintain a low level of sugar in the blood that the pancreas is happy with. It can keep up with that. But when you eat a donut, your sugar could spike to 300. When you eat a banana, your sugar may go to 120 or 125. You know, and it will stay like that at even keel. So The fruit does not cause diabetes on any means. The processed sugars will, because they spike your sugar up way too high. And on a pancreas that's already overburdened, it cannot keep up with those big spikes that are happening just all of a sudden. But it can keep up with the sugar coming from your fruit for sure.
What's the role of protein for a diabetic?
So protein is fine for diabetics, but unfortunately they're eating way too much protein, which will then convert to fat. So we eat way too much protein in our diet. The meat industry tells us how much protein to eat, okay? They're not really telling us what our body actually needs. So after 75, 80 grams, don't quote me on that, but when you get over 75 or 80 grams of protein in your diet, the rest of it is converted to fat. So there you go, you're clogging your organs back up again. And a lot of our meats, even our lean meats, are still got a lot of hidden fat in there. Pork meat is the worst meat to eat, I'll be honest with you. Pork fat stays in the bloodstream for about 24 hours, whereas fat off of your steak or off of your chicken only stays in the bloodstream for about 8 hours. So pork fat will stay and clog up your organs and be very slow at clearing out. So pork fat is very, very hard on diabetics, and a lot of them eat a lot of bacon and things like that. And they're just making their pancreas worse and worse and worse over time. But it's easy to reverse. It's a different mindset. But I tell diabetics, just trust me. You're not going to, if you need more medication, we'll give you more medication, but you're not going to need that. You're actually going to come off of it. And they're all shocked when that happens. So it's really quite remarkable.
What do you see as the role of genetics in diabetes, specifically type 1? And is there anything that you can do to help?
Yeah, I don't really, there probably is a genetic component, I'm sure. You can blame everything on the genes, but do know that genes are turned on and off. And when you see type 1 diabetes running through a family, they're not inherited. There's not a gene problem there. They're actually inheriting the toxin and viruses that are compromising that person's pancreas. So I don't ever blame anything on genes, because genes can be turned on and off by your environment, by your thoughts, by your mood, by what you eat. They can be turned on and off very, very easily. So I don't really buy into the whole gene thing of causing any disease in the body, including cancer. That genes can be turned off, on and off very, very easily. And if you tell somebody it's genetic, well, there it stops right there. Oh, it's my genes, I can do nothing about it. And so I never tell people that, because then they feel hopeless and helpless and they won't do anything because, oh, it's genetic, right? And so I never tell people that, because that means that there's nothing to do about that. Can't change your genes, right? That's what you were born with. But you can turn your genes on and off. So I believe that what people are experiencing is that they're inheriting viruses that are detrimental to their pancreases. And that's when you see them coming on down the family line. Or they've just, babies nowadays, there's more and more type 1 diabetes than there ever has been before. But our babies are born very, very toxic. 25 years ago, even longer, we were born with maybe 20 toxins in our bloodstream. Now it's 200 to 300 toxins in our bloodstream. So that's a heavy burden on the liver. So they're already coming into the world with a very compromised liver. And if you believe in that the liver protects the pancreas, then you can see why pre or type 1 diabetes is happening just earlier and earlier and earlier in young people. But it doesn't take much to create type 1 diabetes. It's just a viral infection, and it can happen to anyone at any time. And it doesn't even have to be in their family line. They come in with a bad liver, then they get some kind of virus, and that infected their pancreas. And then now those little beta cells and insulin producers are now compromised. Also for type 1 diabetics or type 2, any of the diabetics, digestion is a big problem for them. They do not break down their nutrients very well because of their poorly functioning pancreas. So for those guys, I don't recommend digestive enzymes. I used to, and I think they are beneficial for some people. They do feel better on them. But I'd say just eat all the fruit. It will fix everything. I'm telling you, it does. I have seen it over and over again. I have seen remarkable recoveries when people start eating a lot of fruit. So 1 or 2 bananas a day and an apple, forget about it, that's going to do nothing. But if you eat 6 bananas and 4 or 5 apples and a big bowl of grapes and watermelon, there's where you see the change in people's health, when they actually eat large quantities of fruit. And they feel better, the body's functioning better, all their labs go to normal, we get them off all their medications. It's really, really quite remarkable to see that and how easy it was.
I would assume you would have to continue that same diet to maintain your reversal, if you will.
Exactly, exactly. And with the type ones, it's hard. The type ones are young and it's hard for them to stick to anything because they want to be like everyone else. And it's very, very difficult for them to stick to anything. Their mindset is different. We have to give them a lot of empathy because they are struggling and they're not getting any sugar in their cells. So they stay in kind of in a lower state than the rest of us that don't have type 1. So the type 1s have to be supported emotionally, physically, all the way around. I have a type 1, she's 50 years old. She's been type 1 since she was 6. And her sugars are all over the place, and they have been for quite some time. And she's in very poor health. But she went on this protocol with the fruit and lowering the fat, and she is doing so well. She said her sugars are better than they've ever been in her entire life, that she's dropped her insulin at least in half, if not more. She's lost weight, she has more energy, and before she's just been sick, just sickly her entire life. But she hadn't eaten hardly any fruit. She wasn't supposed to. So, and she knows if she doesn't maintain that way of eating and keep her stress down, then her sugars are going right back up again. So we just have to just really take care of our pancreases and not allow that to happen. And through eating a lot of fruit and taking a lot of these wonderful supplements from Young Living, we can definitely keep our bodies a lot healthier and happier too.
If anybody else has questions, unmute yourself or put it in the chat. I had one more that I thought of. Which was, if someone is listening to this and they want to make these changes, do you recommend that they consult with you or someone before jumping in, or just monitor and go for it?
Yeah, I tell people to go for it because it truly is that simple. It truly is that simple. If you are pre-diabetic, if you have poor sugar control, which means you're dropping your sugar throughout the day, if you have type 1 diabetes, go for it. Start eating a lot of fruit and dropping your fat in your diet. And that you will see significant improvement in your blood sugars once you start doing that. And then that's just, reason for you to keep going and keep going on that. And I've just seen it and it's really quite remarkable. See, someone asked about artificial sweeteners. Artificial sweeteners. Yeah. So, even diabetics can have honey. They can have raw honey. They can have maple syrup. There may be a ton of sugar in those things, but they are, again, long-acting sugars. So they will not make your diabetes worse. But they're very powerful antivirals, and they're very powerful antibacterial. So raw honey and sugar, some of the sweeteners, maybe some stevia, definitely artificial sweeteners, no way. Stay away from artificial sweeteners. Though that's poison. You're just adding more toxins to your pancreas and your liver. So artificial sweeteners are a huge no-no. I know they have no sugar in it, but they are pure poison. So, and you want to unload your pancreas of the toxins and the fats. So you got to stay away from artificial sweeteners too. And then somebody asked about the 5 fruits: blueberries, papayas, blackberries, apples, and raspberries are the top fruits for type 2 diabetics. They also, some of the top veggies for type 2 or for pancreas health is spinach, celery, sprouts, kale, and asparagus. And squash and sweet potatoes. So those are some of the main fruits that are very nourishing to our pancreases, but all fruit is totally as much as you can eat.
I think there's a question about, for someone who's not diabetic, how much fruit do you recommend daily?
Yeah, for non-diabetics, eat as much as you can eat. Tell everyone lemon water in the morning, keep that liver clean. We got to keep our livers clean. That's what is protecting the body. When your major detoxification organ starts to get sluggish, that's when you start developing physical symptoms and other organ systems. So anybody that comes into me with some type of chronic problem, be it headaches, foot pain, stomach hurts, hair loss, I always go to the liver, because if we don't clean up your detoxification organ, nothing else is going to work. So for non-diabetics, they should eat as much as they can do. Start doing fruit smoothies in the morning, and then just eating more fruit throughout your day. Grab an apple here and there, a couple of bananas, eat some fruit before you go to bed. Make fruit a part of every day, and not just the what is it, 4 to 5 servings that they say you need to eat as much as you like to eat. Make that your dinner, just a whole big thing of fruit. I'll cut up a whole ton of fruit on Sunday nights and I'll pour raw honey on it. And the raw honey preserves the fruit. So I can eat on that giant bowl for about a week before it starts going bad. And so you always have it available. And when it's soaked in that raw honey, it's delicious. So definitely just eat as much as you can eat. Start increasing the fruit in your diet. Don't believe what they say about the sugar, because it's not true when it comes to fruit. So you will be happier and healthier. It's just remarkable the changes I've seen in people just by them eating fruit. It's really remarkable.
When you talk about the low fat, I would assume you're talking about things that are naturally low fat and not buying like low fat sour cream or low fat, like an artificial low fat, or do you have a preference?
Yes, that's a good point. Yeah, your artificial low fat things like you're talking about, yeah, those are no good. If you're going to eat butter, eat real butter, okay? Don't go to the fake butters because those are toxins. So I'd rather you eat real butter and have that little extra fat than eat something like even soy. Soy is not a good product. Soy is very toxic. It's one of the most heavily GMO'd and pesticides products on the market right now. I do not recommend people eating soy at all. And I don't care if it's fermented, unfermented, organic, clean, whatever. It's all very, very toxic. Soy is. So I do not recommend that for people. And people will go to those products because they think they're cleaner and they're healthier, but they are not. So if you're going to eat butter, eat real butter. If you're going to eat cheese, eat real cheese. You know, go for the stuff that our grandparents ate, you know, and that's going to be much healthier because the body recognizes that and understands what to do with that. All this artificial fake food, the body just stores it as toxins. And now whatever area, whatever organ those toxins are stored in, then that organ becomes dysfunctional, whether it's your thyroid, your liver, your pancreas, your adrenals, your kidneys, whatever. That's what happens to those organ systems. They get toxins loaded in them, stored in them, and they get viruses stored in them. And now that organ becomes dysfunctional because of that.
Amazing. Anybody else have any other questions or comments?
I do. I have a question. I know that we're talking about diabetes, which is related to the pancreas. How does that, what you're telling us to do for the pancreas, is that good for pancreatic cancer?
That's a great question. So pancreatic cancer, the protocol for pancreatic cancer is very, very large doses of digestive enzymes. There is a physician on the East Coast, Dr. Gonzalez. I believe he's in New York. He has since been killed. He's a holistic doctor that they didn't like that he was curing pancreatic cancer, so they did away with him several years ago. But I believe his daughter is still running his clinic. And you can Google him, and he has his pancreatic cancer protocol online, at least he used to. And it requires taking a ton of digestive enzymes. And I think the purpose of that is to have the pancreas to rest, and so it can repair and rejuvenate. And I think it counteracts the cancer too with all of those digestive pancreatic enzymes that they end up taking. But he's got a good protocol in there, and he's been the most successful in reversing pancreatic cancer than anyone that I've ever known of. So Dr. Gonzalez, I believe he's around the New York area, but if you Google Dr. Gonzalez pancreatic cancer, his website should pop up. And he does have his protocol on there, or you can go call him for a consultation too. And they'll do that via Zoom for pancreatic cancer patients. So yeah, you got to take care of that pancreas. It's that delicate little flower, and it can get heavily burdened with toxins and viruses. And now you have cancer. Now you have pancreatic cancer. And as we all know, that's a very, that's a terminal cancer. It's very hard to reverse. But Dr. Gonzalez came up with a protocol. It's pretty lengthy on what they have to do, but if you have the will to live, you'll do it. Yeah, great question.
I just made a connection that a friend of mine suffers severely from pancreatitis and has gone through all kinds of treatments. And they finally figured out that she was consuming huge amounts of aged cheese, a lot of aged cheese. It's just something that she loved, she craved, and she took a lot of that. And once she cut that out of her diet, her pancreas and her pancreatitis it's improved dramatically.
Wow.
So it's that high fat in
Yes.
the aged cheese, and
Mhm.
blaming her pancreas.
Yes, yeah, we went through that low fat craze there for a while, and they dumped a ton of sugar into our foods. And so now everything's reversed, where now it's low carb and high fat. We were actually a little healthier when we were doing the low fat, even though they were dumping sugar in our food. We were actually much healthier than we are during this last 15, 20 years, where everybody's doing the high fat stuff and high protein. So the amount of health problems that are occurring now that are chronic is higher than it's ever been in American or in history of the world, actually. And I believe totally due to our fake food and to our lack of nutrition, because we quit eating fruit. They say that in America, fruit consumption's gone down by like 40% because of the keto craze in the last 15, 20 years. And so we have seen so much autoimmune and cancer and chronic everything since that has happened. So we got to get back to just eating a ton of fruit. But remember, if you're trying to heal from some type of chronic issue, it has to be large quantities of fruit. People will come into me and tell me they've had a banana and an apple and an orange, and that's it, and they still have their symptoms because they're not eating enough. But those that are really on board with eating a lot of fruit, they come in, 99% of their physical symptoms are gone, including anxiety and depression. That is something we overlook as being part of the problem with our diet. But I've had a lot of people that I'm like, let's not deal with your anxiety and depression right now. Let's wait after you go on this protocol and we'll see if it's still there. And a lot of times it's gone away. So that's a state that's a body that's chronically inflamed and toxic and creating the anxiety and depression. So it's actually even a cure-all for that. It's really quite remarkable. Just nutrition, that's what it is, with the Ninja Red and all the great stuff from Young Living. It's totally making our bodies help them heal itself by detoxing and nourishing.
Wow, super fascinating. Thank you, Erica. Any last words, or how can people find you if they want to work with you?
Yeah, so you can just, I'm kind of getting booked out. So my next available appointments for new patients are now in October. But I'm in Sellersburg, so Holistic Family Medicine in Sellersburg. And I'd be glad to talk to anybody about any of this, and keep an eye on your blood work and keep an eye on your medications. And, I'd be glad to work with anyone that's struggling with any type of issue, chronic or non-chronic. But just know that I will put you on a high fruit diet. That is going to be the prescription. Because it works. So that when you come to me, if you don't like fruit, we're going to have to find a way to get some fruit in you. But fruit, really, because we're so malnourished, we're all running on fumes, we're overstressed, our adrenals are shot, our livers are sluggish, our pancreas are compromised, our brain health is, we can't remember what we ate, a half hour ago. So the nutrition is the key. That is the key. No supplement, in my view, is going to help that. Supplement's a good addition to what you're doing, but you have to get back to real food. You have to get back to eating what God put in the ground for us to nourish and keep our bodies healthy. So yeah, if you come see me, prepare to start eating a lot of fruit.
I love it. And there's a lot of credibility knowing that you've said you've witnessed
Yes.
You've witnessed transformation. So that gives us hope.
Yeah. So there's a question. She has a friend who has no pancreas. Is that true? Is there any help for her? Is like she truly has no pancreas?
Is that a thing? No.
I've never heard of that. But that could be a thing. I've never met a patient or seen that in 20 plus years. Wow, that's it. So obviously that's maybe from birth. If they were born, they've got to have something that's producing insulin. There's got to be some type of structure there that's taken that over, and maybe not. Now that truly there would be something genetic, if you're not born, if you don't have a pancreas. Is there any help for her? That's a good question. I would say yes. Oh, it was removed surgically. Wow. Well, she would have to take digestive enzymes and she would have to take insulin. Those are the two main functions of the pancreas. So when you don't have an organ that automatically does that, she has insulin pump. Yeah, that's what you have to do. So you have to externalize it through insulin pumps and digestive enzymes. But yeah, that's a good thing. Good point there. I've not really heard of anybody that's had that, unless they had pancreatic cancer or something and they had their partially removed. But usually they like to leave a little bit in there, but circumstances are different for everyone. But yeah, unfortunately in that situation, the fruit will still help her, because whatever caused her pancreas to have to be removed in the first place could also happen to other organs, especially if it's viruses and toxins. So yeah, the fruit would be beneficial for that person to prevent any other organ from needing to be surgically removed for whatever reason.
There we go.
Good point.
Well, thank you so much, Erica, for your time. Hopefully you can get some rest and time with your family this evening, and I appreciate you. This will be recorded and posted on our YouTube channel if Erica is okay with that. So if you're watching the replay, would love for you to subscribe and get our notifications, because we do calls like this all the time that are so fascinating and helpful, and on this journey to be well the way God intended. So thank you all for your time. Thank you, Erica.
Thank you. Thank you. Thank you, everyone. Have a good night. Eat your fruit.
Bye-bye.
Bye-bye.